Amy Swanson, CEO of Voices for Ohio's Children. So we are very excited to see the creation of the Office of Health Transformation. The unique nature of serving children and the holistic needs of those kids have traditionally been served through so many of the departments that have been convened under this new centralized body. And what's so exciting is the opportunity that this administration has taken to focus and provide a coordinated approach to healthcare for all of Ohioans, kids, adults, seniors. And it's particularly important for children whose healthcare needs really dramatically change, are very different in services for our youngest children, and very critical points of time for those young children, all the way to serving pregnant women, and what those cost factors are, and what the preventative nature of many of the services that young children get, and then the adolescent care that we have, and then as they transition on to be young adults. And so because those services have traditionally been parked in all of these agencies, the opportunity that the Office of Health Transformation has to really sharpen the pencil on what are we funding, how are those services accessible for our families, and most importantly, how can we improve the health outcomes for all Ohioans, as well as the accessibility and efficiency of our system. We can no longer do business as usual. There are no single antidotes to solving our healthcare problems, our behavioral healthcare problems, our educational system problems. This takes a unique collaborative approach to say, what can we do better with what we have? What maybe do we need to think about eliminating in the short term or even long term? And what could we put in place that is evidence-based to improve outcomes? Because at the end of the day, we hope that there are no children with presenting, the first day of kindergarten. Our hope is that an office like this could help us make sure that there are no presenting vision issues, or they've been dealt with for a child if they walk into kindergarten classroom, that they've had a healthy meal or snack that morning, they get physical activity that keeps their brain wired, that they come in and they've received their preventative immunizations, they get their annual well child checkups, that they have no hearing issues, and that they can participate as a productive member in that classroom with other young people. And so, at the end of the day, we want those outcomes for all of Ohio's kids, regardless of what setting they're in, or regardless of what conditions they may have. And so the notion of the collaboration that is going to occur through this Office of Health Transformation, it's historic. And we are so excited about the opportunity to seize this moment in history to get better outcomes and improved outcomes for all of Ohio's children and their families.